labor and health. Amanda, let's go ahead and put us live. Oh, that was quick. That was the fastest anybody's ever listened to what I said. Good morning and welcome to Labor and Health in the Senate. Mike, why don't you go ahead and call roll?
Okay. Senator Burchard.
Here.
Senator Furphy.
Here.
Senator Hutchings.
Here.
Senator McCune.
Go YO.
Chairman Baldwin.
I'm here. Welcome to Labor and Health this morning. We have one bill before us this morning. It's House Bill 217, Community Health Center and Rural Health Clinic Grants. To present it to us today, we have our chairman from the House side. Welcome, Chairman Wilson. Go ahead and talk to us and tell us your wisdom.
Thank you, Mr. Chairman. Committee, good morning. Sue Wilson, representative and chairman of House Labor. So we'll be seeing each other during the interim. You may notice that this bill bears some resemblance to a bill you considered earlier in the session. And after consultation with some folks, I'm bringing it back to you in an improved and slimmed down form. So I do want to point out, even before I get started on the explanation, in the title, Community Health Center and Rural Health Clinic Grants, I just want to point out that the word grants is a leftover from existing statute, and there is no appropriation in this bill, and no specific grants are anticipated or really part of it. What we're doing is just maintaining an existing structure. So just to be clear about that. Okay, so back in the spring, you may imagine we had some occasion to contemplate our public health statutes and how things were going and what could we do, make sure people were getting healthcare services. And this particular section came to mind. It's existing law. I had worked with it a couple of years ago on another thing. And so I kind of delved into it. This is a section in statute that we drafted in 2011. And the purpose at that time was to run some general fund money through community health centers and rural health clinics. And these are clinics, there are 39 right now across the state, and their focus is providing primary care. So that's, doctor's office type visits to low income people and underserved people. That's the entirety of the category of healthcare provider that we're looking at in this. And they did make some grants out of that since 2016. Well, actually, since the original 2011, no new money has gone into this. But the structure is still there. And I think it's a really valuable structure. And so this bill does three things, and I'll go through the bill, but you can see it's fairly short. The bill does three things. First of all, there's a sunset date for this summer, and I think that should be deleted for a couple of reasons. One, if we're ever rich again, we could give general fund grants. I don't think that will happen anytime soon, but we could. There are sometimes federal grants. The thing that I really want to focus on, and I think is so valuable in this time, is there are a lot of charitable organizations, national foundations, who give out grants for rural health or low income health needs, that kind of thing. And, of course, you can't mention specific names on the floor, but for example, the Helmsley Foundation, Pew Foundation, Robert Wood Johnson, those sort of organizations. And as a matter of fact, and I didn't want to overwhelm you folks with paper, but the Helmsley Foundation, and let me just give you an example of this kind of thing. So the Helmsley Foundation gave out $14 million to first responders and law enforcement folks with external defibrillators. Great. I mean, that's and a lot of times this money is funneled through state health departments. These clinics that we're talking about are all independent, private, nonprofit groups, okay? But it's actually a good thing that they don't have administrative overhead that runs around finding grants just for them. So it's helpful to be able to run them through, and you're going to hear from the Association of Primary Care Clinics, but to be able to run larger grants out to clinics, so I can really see us being a funnel for this type of private foundation. One of the reasons that I think it's also good for us to get rid of the sunset date in its entirety is because a lot of these grant programs are 2 and 3 year projects. And, certainly if I were an administrator at one of these foundations and the state of Wyoming came to us and said, hey, we would like to participate in your $4 million grant for whatever it might be, telehealth equipment, and it was a 3-year grant, and the person at the foundation said, well, I see your statutory authority expires next year, so what will happen then? It really cuts our ability to take on some of these a little bit longer term grants when it looks like the structure is going away. So that would be a recommendation on there. So as I said, the first purpose of the bill, to delete the sunset clause. The second one is to add equipment to the allowable expenditures. When it was first put together in 2011, it was, and you can see on the bottom of the bill, it says capital construction startup costs. That was the thinking back in 2011. I don't personally think we need a whole lot more of buildings and rooms. I mean, maybe occasionally, but I think the need for equipment is pretty significant. So things like ultrasound machines, maybe a wheelchair ramp, elevator combo, telehealth equipment. I think that we could have a great ability to, say, loan out patient monitoring equipment for post-op patients who've maybe been in, an inpatient, had surgery, say in Gillette or Casper. Now they're back on their ranch and they need maybe some post-op follow-up for a month rather than have to drive in twice a week. If they could use telehealth but just check it out. Now you don't have to acquire this piece of equipment, borrow it from someplace and return it. So I think equipment is a really valuable addition, and that's a new addition that was not in the original bill. And the third point of the bill is to clarify, there were a bunch of restrictions when we wrote it originally. I'm not getting rid of the restrictions, but the restrictions were really only for when we made general fund grants, which makes sense. I mean, as far as a state. And so you won't see many of the restrictions because they're not being brought into the bill. But they were involved things like if we gave a grant, a general fund grant, the recipient had to go before the county commissioners or various other things like that. That's fine. And I'm not taking those out for any general fund money. If we ever did that again, we can deal with that then. But you keep in mind that these are private organizations. And if their local Kiwanis, say, wants to give them $10,000 for heart monitors, I don't see that the state has any business telling a private organization in Kiwanis that they need to go to the county commissioners. I mean, so the only thing that is in there is just a clarification that those restrictions apply only to if we were to give state money, not private donations. I mean, we can't really direct that. So if we'll just look at the bill, you can see on the bottom of page 1, the title of that section has got the amendment in it. You don't see it in its usual form with the underlining. I'm not quite sure why that is, but you'll see on line 13, it adds and equipment costs. Then on page 2, you can see line 3, we're adding in the equipment costs. The lines 5 through 8 is just the language specifying the grants, and then you'll see that some sections are missing, the A, the B, and the C, and that's, so clearly sections that are not changed are not in the bill. Part B, or paragraph B, was where they set up the account. And then you'll see C is just cleanup language regarding this section. Paragraph D, this is where I clarify any grants provided by the department that are funded in whole or part with state funds shall be subject to the following. And then the restrictions maintained there for state funds. And then we have on the top of page 3, lines 3 and 4, we're just inserting the equipment word because I think that is very helpful. Then there's, as I say, other language that is not being changed. And then line 11 is there are 2 repealers. The first 92127D6, when the bill was written in 2011, we required proof of a specific federal designation. as you know, the feds change their names of things pretty regularly, and I see no need to tie our state statute to any kind of specific federal name of something or other. I mean, these are clearly clinics that serve low-income people, and we don't really care if they have a federal name of something or other. And then G is the sunset date. So, Mr. Chairman, that's actually all the specifics of the bill. I would be glad to flesh it out if there are questions.
Very good. Questions, committee? Senator Hutchins.
Thank you, Mr. Chairman. Representative Wilson, liked your presentation. Thank you very much. Just a quick question. Here in Cheyenne, and I don't know about too many of the other smaller communities, we can get anywhere in Cheyenne in about 15, 20 minutes. So I'm wondering why we need these clinics when we have, let's say in Cheyenne, when we have the hospital. Is there, or are there other areas within the state where we have hospitals where they can borrow rooms or sections to have these clinics instead of having whole new clinics to put equipment in and being able to transfer it from here to there, borrow it? If we have it in the hospital, it's just, it stays put and we can use it there. Just a question that popped in my head when I was reading this last night.
Chairman Wilson.
Mr. Chairman, Senator Hutchings. So that's a good question. And one is there are many communities that do not have hospitals, or their hospital has 4 beds or something like that. The other thing is that these are primary care clinics. So the kind of place where you go to get your children's vaccinations, if you think you have bronchitis, you don't really want that kind of person cluttering up the ER, if I may call it that. You know, it's the emergency rooms have very high expenses. You don't want to lay them over on a person who really is just there because their kid needs their tetanus shot. I mean, it's not a good use of services. And again, the clinics are, as I say, there are, I think I said 39. Yeah. There's a number of, and I'm, Senator McEwen, I'm not quite, what community, are you from Gillette?
Yes, ma'am.
So but they actually don't have one in Gillette because I guess there aren't enough low-income people in Gillette. But there's one in Hewlett, there's one in Sundance. So those are places where, you know, there are fewer hospital facilities. So it's actually a better use of overhead, in a sense, to be able to build a small clinic instead of something with overnight beds.
Senator Furphy.
Thank you, Mr. Chairman. Chairman Wilson, let me ask, in our community, our hospital was approached by a smaller community that had no facilities. So the hospital helped work with them, provide staff to get them going, etc. But because the hospital was initially involved, would that community be eliminated from these grants? Thank you.
Chairman Wilson.
Mr. Chairman, so again, because there are a lot of sources of grants, I wouldn't necessarily be able to answer on every, I mean, for example, grants from just, and I just picked the Helmsley Foundation, they can grant however they wish to grant. The original general fund grants that we gave, which we are not doing anymore, were specific to certain categories of nonprofits. Some of the nonprofit clinics are operated by hospitals. If the hospital is also a nonprofit and falls on, and they can open up the clinic, maybe as Senator Hutchings said, in a next door space. So again, I'm not setting up a specific grant program. I'm just trying to maintain a structure so that if, as I say, now I think a particular use is for foundation grants, and they can really do it how they want to. As a state, we don't give grants according to the Constitution to profit-making organizations, particularly unless it's for, I mean, in the Constitution it says the necessary support of the poor. So that would just be up to the specifics of the grant, the decision-making, the governance structure of a facility, that sort of thing.
Further questions? Senator Burchard?
Thank you, Mr. Chairman. Used to the automatic microphones. Thank you, Mr. Chairman. And I think I want to just touch on something and maybe make sure we're clarified because of Senator Hutchings' question about Cheyenne specifically. We have a couple of clinics here in Cheyenne that actually are nonprofits and operate a lot of basically on grants, and they take care of homeless people that really just can't even make it to the hospital for one reason or another, maybe not even having an ID card. One of them has a traveling clinic. I don't know. We've seen it in health committee before. They brought it up to, I think we were in Riverton or somewhere. You remember that? So what I'm seeing here, and I'm on the bill obviously, but I want to make sure that I understand that everything that's going on. Would even a clinic like that works with homeless, they would be able to take one of these nonprofit grants, right, from one of these other. I'm trying to think of the names here, Helmsley or Pew Foundation. If they were willing, they would be able to beef them up that way. Is that correct?
Mr. Chairman, yes. So actually the two clinics in Cheyenne that fall under this are the clinic on Fox Farm, which is probably the one you're thinking of, or I think the one downtown, it doesn't fall under that governance structure. And then actually the UW Family Medicine Clinic. The requirements for a number of these clinics, and I don't want to get into like national nonprofit 501c3 type law and that sort of thing, but they may or may not. And again, that's why I'm taking out the specificity of federal requirement. I don't think we need to tie ourselves to that, but a lot of them have community boards made up, where half of the people have to be made up from that type of person who is served by that clinic. So, and just to kind of bring it back, even though that wasn't specifically, but you mentioned about the homeless or that sort of thing, they operate on sliding scales. So in other words, when a person comes in to receive care, you have to bring in proof of your income, whether it's a tax form or your veterans benefit slip or something like that. And then depending on what your income is, that's how they decide how much to charge you. So for example, if you make 200% of the federal poverty level, you have to pay full rate. If you're a person making minimum wage, which I think is $7.25 an hour, working full time, then you're at about 100% of the federal poverty level, and you might only have to pay $20. So they do take in income from their patients if the patients are able to pay. And then, as you say, I know the one here in Cheyenne can receive United Way money. I mean, I've given money to them through United Way, a variety of sources. I sort of lost. Did I end up answering the question, Senator Bouchard?
Go ahead,
Mr. Chairman. Yeah, I mean, I wanted people to understand that like Crossroads is the clinic that I was thinking about. They're the ones that have the mobile. They do a lot of the homeless stuff here in town. So and I think if I'm not mistaken, the homeless shelter is going to start doing some things because they purchased a building next door. I don't know all the details, but.
And in fact, I think this bill could really help the smaller clinics, because as I said, Crossroads is not on this original list. When you have a smaller clinic like that basically has, someone that runs the operation and maybe a nurse and a lab tech or something like that, they clearly do not have the time in their life to figure out how to apply for a grant. I mean, these are writing up these grant applications is a big deal. But on the other hand, if they could participate with a grant from Helmsley or Robert Wood Johnson or whoever, say that they gave out $2 million for, whatever, diabetic stick equipment or something like that, then actually the clinics that were smaller are now have the opportunity, no one's ever mandated obviously to participate, but have the opportunity to have a little bit more access to some of this foundation and donor money, which I think would really be helpful.
I'll put in a plug here too, is that maybe one of our meetings this summer, since we have so many new members between the two groups, maybe perhaps in Casper or wherever, we could go to the community health center and maybe take a look at it. That's something to consider.
Good idea.
That was my plug. I don't get any points for that. Any further questions, committee? Senator Hutchins?
Yeah, thank you, Mr. Chairman. Some of the questions or comments by Senator Bouchard raised some more thoughts in my mind. I love the thought about a mobile clinic. I think that's a really cool idea of thinking about like life choice, someone rolling around town and taking care of elderly, homeless, whatever. But I'm new to the committee, could be very, very naive, but what if 2 or 3 doctors and 2 or 3 nurses got together and said, we want to just start up our own little private clinic to help people? Would this bill wouldn't, I guess, affect them, because in my mind, this bill is only, or this process is only started because you're taking money from the state. You are wanting grants from the state, the general fund. So if I'm just on my own, and let's say my church or people in the community wanted to get together and put money into this little clinic that I wanted to start, could I do that without any government interference at all? Or would there always be government interference? Does that make sense to you?
Well, it does, although it's a
Okay.
little bit beyond, Mr. Chairman,
Go ahead.
it's a little bit beyond the scope of this bill. The bill in some of the sections that we have not brought in because they're still there, they're specific to specific low income, providing in an underserved community and such like. So your standard doctor's office with a couple of doctors and a couple of nurses that you go to for your own primary care, that they're a profit-making operation. You know, the doctors are there to make money for themselves and their families. I mean, that's how they live. If you want to set up a nonprofit where you're not taxed, you know, there's a whole process through the Secretary of State, you know, your 501c3 form from the IRS and such like. So if you were actually a profit-making operation, it's possible that you might fit in through this in the existing, you know, general fund category. But frankly, if you're, and I'm looking at existing statute, which you don't have in front of you, for the applicant to demonstrate an operating plan that integrates healthcare within the entire service community, providing for and serving in an underserved community with as its first priority, various categories of poor people. If you did that, I find it hard to see that you could make a profit. So I don't think you could actually sign up to do that and be a for-profit. So therefore, you may as well be a nonprofit, and then you would fall into this category. But certainly you know, we do, I mean, obviously you need to be a licensed physician if you're going to provide physician services and that sort of thing. Actually, Chairman Baldwin can probably give better advice than I as a PA, but I think that if you come into this community and you're a doctor or a PA and you want to open up your office, I'm not really sure what licensing you need other than to be a licensed provider.
Right, and simple things like the CLIA waiver and things like that, if you're gonna do I mean, there's a number of things, you have to meet the medical requirements, but, yeah.
Well, thank you. I know that was kind of off topic, but it just popped in my head. So thank you. Thank you. Mr.
Further
Chairman.
questions, committee? No further questions. Thank you, Chairman Wilson. We'll let you have a seat. Don't run far away.
Nope, I think there are a few more probably.
I see some people anxious to speak. I see Department of Health walked in. He was bored in the hall and walked in. Would you like to speak to us, sir? No? I can't read your lips, but I think I
Just
heard no.
that masked man.
Anybody else in the audience that would like to speak to us? Ms. Cartwright, would you like to speak to us? Come on up. Yeah, you can come up with her. Welcome to Labor and Health. Go ahead and introduce yourselves and share your wisdom with us.
Good morning, Mr. Chairman. I appreciate this opportunity to speak to the committee. I'm Jan Cartwright. I'm the Executive Director of the Wyoming Primary Care Association. And with me is Mary Lynn Chickish, who works with us and is here to answer questions. And if it's okay, I'll give you some remarks and then we can answer questions. Thank you. So we really appreciate the chance to talk about House Bill 217. I also want to thank the sponsor, Madam Chairman, and the co-sponsors. I will focus most of my remarks on the community health centers that my organization represents. They are part of the healthcare safety net that includes rural health clinics and free clinics in Wyoming. Health centers, also known as federally qualified health centers or FQHCs, provide healthcare for people regardless of their insurance status or their ability to pay for their care. FQHCs will not turn anyone away. There are 8 health centers in Wyoming, and these are programs that are specific nomenclature. And as Madam Chairman said, they are nonprofit and they're community driven. So they're driven by a community board. I emailed some information to you this morning about the value and impact of community health centers to the state this morning, a little late, I'm sorry. In that information, there is data specifically to the fact that in Wyoming, health centers saved the system $56 million in 2019, including $15 million in savings to Medicaid. FQHCs do this by providing appropriate primary care at the appropriate time and by keeping people out of the emergency room. Wyoming Health Centers provided care to 39,000 of your fellow Wyoming citizens in 2019. And Mr. Chairman, Senator Burchard is correct. The Crossroads Clinic here in Cheyenne, as well as HealthWorks on Fox Farm, are both members of my organization, both designated as federally qualified health centers. They also provide quality. Most of our health centers are designated as patient-centered medical home. The 12th Street Clinic in Casper was one of 200 health centers in the country to receive a Health Center Quality Award in 2019. 12th Street, along with the Crossroads Clinic, provide care specifically to people who are homeless. And last week, the Crossroads Clinic did start to accept vaccines directly from the manufacturer to provide COVID vaccines to people who are homeless and others in the community. The bill today, as Madam Chairman said, amends legislation in 2011 that I'm proud to say was sponsored by the Joint Labor Health Committee at that time. The original $1 million that were in that bill were successful in helping specifically the community of Powell to compete for federal funding at the national level, and they opened their clinic in 2015. Today, they serve the Grable community as well as Powell, and they're a strong partner to the hospital and the school district. Community health centers are the workhorses in their community, and they do it without any ongoing state funding. And even though the state cannot currently provide additional funding, this bill deletes the sunset date so that when the economy improves, health centers and rural health clinics will have a statute that supports their work. And so I do think it's important to address the fact, again, that this safety net is meant for people who do not have insurance, who really can't pay for their cost of care. And all of these clinics do try to provide that. Beyond that, then specifically, I think that some of the health centers have spoken to some members, specifically the health center in Casper has a dental operatory. Some of the work that they do is to do wraparound care for people. And so obviously, as Madam Chairman said, equipment needs to be updated, and that's sort of the focus of this. Thank you, Mr. Chairman.
Thank you. Mary Lynn, would you like to speak to us before we grill you with hard questions?
Thank you, Mr. Chairman. My name is Mary Lynn Shickich, and I work on contract with Jan doing health policy work. And as Jan stated, I just wanted to comment that the clinics are just, there are a handful of them. There are 8 in the state, and Casper has outreach clinics in Riverton and in Du Bois, and the only healthcare clinic per se in Du Bois is this particular one. The population might, for instance, be here in Casper. The folks go to Crossroads might be construction workers, folks who work in hotels and don't have health insurance. And as Jan said, it's really on the ability to pay. They don't typically compete with private practices. The physicians or the other healthcare providers work on a salary, and they're typically not what you would normally see in private industry. We think they're an important asset here in the state, and this bill offers the opportunity for them to access additional funds, federal funds if needed, And I think the chairman on the House side's decision to add equipment is a really important piece to this bill. These clinics operate on really slim margins. They try to do capital replacement funding, but with the slim margins, they don't have capital plans typically that you might see in private industry. And a handful of those clinics, as Jan mentioned, here in Cheyenne and in Casper, they have small dental programs. For folks who don't have insurance, dental care is very difficult to access in the state. And it's limited pay under our insurance programs that are offered to the state, Medicaid and others. So dental care is valuably important, and replacement of dental equipment is extremely expensive. So with this grant opportunity and things, we can hopefully keep those dental parts updated as they necessarily need to be in order to provide the care. And part of that, it's kind of a funny continuum, but to attract a dentist who would want to serve particular populations, it would hopefully attract them in part by having good equipment. So with that, Mr. Chairman, I'd be happy to answer your questions along with Jan. Thank
Very
you.
good. Questions, committee? Senator Furphy.
Thank you, Mr. Chairman. I'm just curious, since I'm from Laramie, just curious why the downtown clinic isn't part of your group, because they do very similar work and do a great job in our community. So, thank you.
Mr. Chairman, Senator Furphy. So the downtown clinic is a free clinic under the federal nomenclature. And so one of the things that it gets as part of the safety net is federal tort claims protection. So it is part of the safety net. It's just that the Albany Community Health Center, also in Laramie, is the community health center in that community. So that's the difference. And I do think that they partner well and, you know, provide care to so many in Laramie that need it, students specifically.
So that's part of the answer to this, because they are a community health center, so they do fall under the. Senator Hutchins, go ahead.
Thank you, Mr. Chairman. Mrs. Cartwright, thank you for the PDF. I'm a very visual learner, and seeing the numbers, seeing the figures, I like that and appreciate that. That really helps. So with the FQHCs, I'm assuming that's a federally qualified healthcare. Tell me, is this the 8 that we have in Wyoming? Is that part of the 39 that the chairman mentioned? Or is this something separate?
Mr.
Ms.
Chairman,
Cartwright.
it is correct, Senator Hutchings. It is part of the number that the Madam Chairman shared with you.
Great. When you guys look for grants, do you look for, excuse me, Mr. Chairman, when you look for grants, are you trying to get them from the federal government first, foundations, or wherever you can find them?
Mr. Chairman, Senator Hutchings, the community health centers receive ongoing funding. And for that, through the federal government, that's why they're designated as such.
Got it.
And for that, they're funded in 3-year cycles. And within that 3 years, they have a very rigorous on-site review. And then they have to compete every 3 years for that funding. Now, it is minimal. It is meant to be about 1/4 of their total operating costs. So they receive in the neighborhood of $600,000 a year. And then that's the reason that they are able to serve people who then cannot pay for the full cost of their care.
Gotcha. Thank you, ma'am.
Thank you.
And I know your committee gets tired of me inserting things here. I was thinking about, we talked about the cost of medical equipment. And medical equipment, I think we underestimate how expensive medical equipment is. And I'm just thinking about a portable x-ray machine, which is a fairly small piece of equipment. Certainly it's smaller than the desk. $500,000. And that was purchased through the Helmsley grant, actually, for a facility that I'm familiar with and worked with recently. So it's very expensive equipment. The defibrillator, you can't find a defibrillator like the one we have in the Senate and on top of the fridge if you don't know where it's at. If I have a heart attack, I'd like you to know where it's at.
Really?
Yeah, please. And, but even that alone is a couple $1,000s, and it's a little tiny box. So items are expensive. Go ahead, follow up, Senator Hutchins.
And I appreciate you interjecting, Mr. Chairman, because it helps me out. I'm going to ask a question that I ask a lot, Mrs. Cartwright or Mary Lynn. because it's dear to my heart. And I don't think we think about it quite as much as we should. What happens when the federal government runs out of money or cuts you off? What will we do? We've provided all these clinics and all this care and services, and the federal government says, there's nothing left. And we really know there's nothing left now. So what's the plan when they're done? There's no more money to get from the federal government.
Mr.
Ms.
Chairman.
Cartwright?
I think that's a very good point to make. I can't predict the future, but I would say that this is a 55-year-old program. It started in 1964, and it has had bipartisan support during the second President Bush's term. The number of community health centers increased by doubled. So it's a good plan. It's a very accountable. I feel that they're very good stewards of federal dollars. Obviously, if the money were to go away, then the programs would probably have to change and have a different funding structure. But again, the federal funds are only meant to be a partial amount that supports those health centers. And so it could be perhaps, and really points to the importance of this bill, that then they would be able to move to a different funding model and perhaps find that other foundation support or other funding support.
Thank you, ma'am.
Thank you.
And I'm
Mr.
going to
Chairman?
interject again. In the past, not in the past, recent past, but in the past several years, there was a decrease in federal funding. And it was, and I keep coming back to Helmsley because that's such a darn big one. We hear from them a lot, but several of these foundations stepped up and actually interjected more money into these kind of centers. And so it's something that they tend to step up when the federal government steps down. So I don't know that's a total solution, but at least it's a partial solution.
Mr. Chairman, I think we failed to mention too, for Senator McEwen's sake, is that the startup of the kids clinic up in Gillette was come from the same source of type of funding. They got a one-time grant. So from our estimation, they would probably be eligible under this program as well.
Absolutely. Further questions for the presenters committee? No further questions. Have a seat back by Chairman Wilson. Or by the Department of Health, he's lonely. Are there any further presentations in the audience? Neither of our back row gentlemen want to comment today. Amanda, do we have anybody online at all?
Mr. Chairman, we do. We have a Miss Stephanie Pyle.
Go ahead and bring her in and go ahead, ma'am. Welcome.
Good morning, Mr. Chairman. Can you hear me?
We can hear you perfect. Go ahead.
Excellent. Good morning, Mr. Chairman, members of the committee. My name is Stephanie Pyle. I'm the Senior Administrator of the Public Health Division with the Wyoming Department of Health. We just wanted to let you know that as the department, we have no concerns with this bill. We think this is a useful change to the statutory language and gives us more flexibility in the grants that can be awarded. We think this is a useful change, as I said, and will be good for local communities as more funding opportunities arise in the future. Chairman Wilson and Ms. Cartwright and Ms. Shickish provided a lot of useful information, and we're supportive of the information they provided and just happy to answer any questions from the committee. Thank you.
Thank you. And I'll ask the first question. I know I'm going to have you grab a number out of the air there, but how many different grant programs do you think that you've seen in the past 10 years that have contributed to things like this, like community health centers? I know it's just, you can't give me an exact number, but that's fine.
Right. You're right, Mr. Chairman. There have been a number of grants, and our team is very astute in terms of researching those opportunities, seeing how they may fit, seeing how they may benefit local communities. So I would say we've had dozens. I can't give you a number off the top of my head, but our team is really always looking for those opportunities and seeing how they may benefit our local communities and seeking those opportunities to the greatest extent possible.
Thank you. I like dozens. That's a good round number. Questions, committee? No questions. Thank you very much for being here today. We appreciate it.
Thank you very much.
Is that all we have, Amanda?
Mr. Chairman, that is it.
Very good. No further comments from the public. Let's go ahead and close the public comment. If you want to come back up, Chairman Wilson, sit closer to the group and we'll go through the bill and make dramatic, horrible changes to the bill. Not really. Committee, would anybody like to move the bill? Senator Hutchins moves the bill. Suggestions, amendments, alternatives?
Mr. Chairman?
Go ahead, Senator Hutchins.
Didn't Chairman Wilson mention she wanted, oh, she did, that's in the bill. Remove the sunset, so never mind.
Correct. That's one of the big things the bill does, is
Gotcha.
remove the sunset date.
Gotcha.
That's important. Further suggestions, comments, committee? Let's go ahead and take roll.
House Bill 217, Senator Bouchard,
He left an aye.
Senator Furphy. Senator Hutchins. Senator McCune,
Aye.
Chairman Baldwin.
Aye.
House Bill 217, 5 ayes.
Congratulations, Chairman Wilson.
Thank you,
We'll
Mr.
carry
Chairman.
forth. I believe Senator Bouchard is going to carry this on the floor for us, so.
He said he would, and I'm going to just put a few papers on his desk to flesh
Very
out
good.
his collection of information. And committee, if I may just put in a little advertisement for the interim, Senator Baldwin and I are kind of working on collecting ideas to have a one-day Zoom training, maybe 4 2-hour, just informational items, because we, on this side and on my side, we have a lot of new folks. So as you kind of put together your mental list of what training you think would be useful, the things that have come to mind so far have been maybe one on what is the general structure and expense of hospitals, you know, what are their costs and what are the things that go into the healthcare costs, specifically hospitals, maybe the Medicaid program, how that works, you know, services for people with developmental disabilities, people in nursing homes, maternity, you know, those, just so you have an understanding of what that is. Another thought that came to mind is we haven't seen, I don't think, too much from DFS in our committee work this year, but what DFS does as far as foster care, residential treatment center, children who are in need of supervision, you know, the CHINS program, the Boys and Girls School, maybe what the continuum of that, those type of services are. So those are just some things that have come to my mind. And as you think of them, so that Senator Baldwin and I can find the appropriate people to put together some of the training modules, if you would just pass that on to him, that would be helpful. And then I'll turn off I'm just going to shuffle my papers for a minute to leave a few
Very
things
good.
with Senator.
Thank you, committee.
Thank you.
We've got a few no, we don't have a few bills. We have one coming up today on the floor. Go ahead.
Thank you, Mr. Chairman. Chairman Wilson, talking about topics, I get a lot of emails about disability waivers. I'd like to understand that whole program as an interim topic.
Yep.
Thank you.
And that is a category of Medicaid.
Yeah.
So, and be sure to have that fully fleshed out section of the Medicaid.
And for the committee information too, we will be having a meeting next week.
Indeed.
With-
Monday, we'll meet and work on.
We'll meet with all of our counterparts. We'll go over all the interim topics and have more discussion. So is that Monday? When are we doing that?
Monday.
Monday.
That's how close we're getting.
So
It'll be just across the hall in my room there.
in the bigger room with more chairs.
Although actually, you guys, you have. just sit rather in front.
We do.
That's his fault.
We don't like each other much.
He puts us apart.
I know these senators, they just require more elbow room. Very good. Thank you, folks. I have to go back.